Welcome to the questions and responses, Q&Rs on Concussions Part 2. Now let's get into it. This question 1 by Maria Boonen. Thank you, Dr. John Bergman. What is a stress x-ray? Fantastic. So a static x-ray is the body is standing under weight bearing, ideally, and you take an x-ray. Then you need to find out what the joints are doing. So you have to take a stress x-ray to see how the joints are moving. And so you're going to bend that to the extreme because most people have loss of curve, forward head carriage. There's going to be something. So what we want to do, if there is a loss or reversal of the curve and some degeneration, we want to see the limit of those joints, how they can move. So we'll literally hold their shoulders and force their head in extension and then take an x-ray to see how they move. Then on the lumbar, we're actually going to have them stand up and have them bend off to the side, and we're palpating the pelvis. And as soon as they bend, when that pelvis starts to recruit, that's when we stop it. So we know that we're isolating the lumbar lateral flexion. And then we can take an x-ray, and then that way we can identify what segments are moving, what segments aren't moving. So this gives us a lot more information and different information than any type of an MRI that's usually done either seated or laying down. The stress x-rays are exactly accurate, and they're essential to identify disc motion or disc dysfunction, and also to give you the idea of how much those joints can regenerate. Because if they're not moving, it's going to be hard to get nutrients into that joint, because the discs of the spine get their nutrients through movement, through imbibition. And so you've got to see if those joints can move. If they can, then you can predict that can be corrected. Also, on scoliosis, when you have a bend in the spine, and all we do to predict if that scoliosis can be corrected or if it's stationary, you bend it into the curve or into the convexity. And any deviation that you see, any reduction in that curve, is the minimal amount of correction that you can make, not maximum. Because what you're doing, you're just seeing what the limit of the ligaments, what the ligaments of the muscles, what ligaments of the different shapes of the bones, what those can accomplish. And we can change the shape of the discs, the shape of the ligaments, even the bones can change through Wolff's Law. But at least that stress x-ray will give you a clue if that scoliosis can be corrected and what's the minimal amount of correction that it can be made. So stress x-rays are essential in patient care to give you a predictability whether an area can be corrected or can't be corrected, and what's the minimal amount of correction possible. Please like this video and subscribe to our channel. It's going to help us grow and spread this message of healing and hope. And thank you for sharing this information. Question 2 from Trauma Chaplain. My particular lingering issue and questions: how do you deal with adhesions and overstretched ligaments? Will chiropractic handle that, or do you need to use another type of therapy? Now, the body is self-healing and self-regulating. When you're looking at adhesions, okay, this could be from a direct trauma, okay, and that you have to work the tissue right there. Because adhesions, literally, if you're tearing tissue, you can have a cross-fiber adhesions because the body's going to protect that area. Overstretched ligaments, you just have to approximate it. Now, number one thing, when we're looking at, say, for an example, a lateral x-ray of the neck, if we see a loss of curve or worse yet, a reversal of the curve, that means the posterior longitudinal ligament's been damaged. And how do you repair it? You approximate it or restore the normal position of motion of the vertebrae, the normal force loading on that, and then the ligaments can regenerate because they're going to remodel to the new configuration or structural configuration, because literally for every 1 inch that heads forward, the pressure on the discs double, typically the C5, C6. So if you have a head that's about 2 inches forward, you're looking at significant force loading on that disc. And if there's a reversal of the curve, this is going to start to change the shape of the bone through Wolff's Law. And so by restoring that curve, you're changing the force loading and you change the structures in that area. So in most of the time, particularly if there's a chronic state of muscle spasms, like if that head's been forward, those muscles, the paravertebrals, which are not under conscious control, I'm talking the muscles that run from the skull all the way down to the sacrum area. And these muscles, they're under proprioceptive control. So if your body's off to the side or forward, they're going to be in a chronic state of spasm. That's why you don't want to loosen up a muscle unless you figure out why it's tight. In scoliosis, the muscles on the outside portion of the curve are always in a hypertonic or a spasm state because they're trying to correct the problem. So you want to figure out why those adhesions are forming. Is it from a chronic state of spasm or direct trauma? So once you've figured that out, by restoring the curve, you can turn off the paravertebrals or correcting any lateral deviation, spinal buckling, or scoliosis. You're going to eliminate the reason those muscles are firing. And then the body can regenerate because all the tissues in the body are living. And this is something that, well, I had an orthopedic surgeon once with a reverse curve in his neck and his hands were going numb. And to have a discussion with him on we need to regenerate the discs. And he said, regenerate discs? And I said, yeah, because discs are alive. Discs are alive? Well, you figure the number one thing that most people take if they have some type of pain is going to be a non-steroidal anti-inflammatory like Advil, Motrin, Aleve. Tylenol does a similar action, but it's not in that category. But that destroys the building block of cartilage. So if you're taking a standard pain reliever that some healthcare professional who's ignorant but wants to help you and get you out of pain, it's destroying the building block of cartilage. So this is why most medical doctors do not see spinal regeneration. So you've got to create a local inflammatory response so the body can regenerate. You've got to change the force loading on it by changing the position of motion, and then the body will remodel to that new configuration. Everything is alive in the body. I even had to tell the surgeon, I said, okay, do you have dead tissue in the body or living tissue in the body? And he said, well, I never looked at it that way. So, you are composed of living tissue. You change the force loading and nutrient position of motion because those vertebrae get their nutrients through motion. And then the body can regenerate. Question 3 from Lam Lucia. What else can I do more than all this to help me go to sleep? I just had a stroke 2 weeks ago. I'm female, 51 years old. I'm having trouble going to sleep. Okay, let's look at the big deal. A stroke is interruption of oxygen to the brain. So that means the blood is going to be under a stress response, which red blood cells should have an electronegative charge where they should be separating. So you, my friend, are in a stress state, and that's causing the cells to clump together more than likely. Or there can be arterial damage from taking seed oils or toxins, which literally damage the arteries that supply the arteries, the vasa vasorum. And that's where narrowing of the arteries comes from. So we've got to correct the cause of the stroke. And you've got 4 blood filters: respiration, perspiration, bowel movements, and urination. So you're going to have a defect in those, and that's a chronic state of stress. So when you're in stress, that sympathetic or fight or flight state, you're going to have poor bowel function, you're going to have poor movement, and then with a stroke, your brain can regenerate. We just have to get symmetrical motion. So 3 things we got to fix on you: physical, chemical, and emotional stress. Physical stress. We need to look at the entire structure because in a stroke, that means that brain has been damaged. So we have to look at the input of the brain, and that's the position and motion of the vertebrae. Then we have to look at the health of the blood. So a live blood cell analysis will be very, very helpful because if you got some of the wacky scenes, that can cause a stress response in the blood. And this can also contribute to that. So we have to look at the health of the blood, get the blood healthy. Then we have to look at the structure. We have to look at the structure, get that healthy. Then we have to give you symmetrical movements so that your brain can start to fire symmetrically, and then you can actually bypass the damaged portion of the brain, and the brain, through neurogenesis, can start to form new neurons. This is why people that have had stroke that have movement difficulty or speech difficulty, that they can relearn and rewire that brain so they can recover from the stroke. So physical, chemical, emotional stress. So once we've identified the physical stressors, we check the nervous system to make sure that that's functioning correctly. We do a thermography because there may be dental toxicities contributing to the problem, such as the amalgam fillings. That's heavy metal poisoning. Okay, or we look at root canals that can have a subclinical infection called a cavitation that can negatively affect your entire body. And then we look at gut function. Okay, so if you're at one bowel movement a day or every other day or diarrhea, if there's some kind of dysfunction there, we have to heal the gut. And that's going to, there's so many processes, but it really boils down to just those three: physical, chemical, emotional stress. So address the cause of the stroke. Okay, and could be medications, could be toxic food, could be a chronic physical state of stress. And then once you've addressed those, then your body can start to regenerate. But know that sleep in you post-stroke is a big indicator that the body is not functioning correctly. So if you address those stressors, and then you will be able to get that deep restorative sleep. But we're building a building. We got to start from the ground up. And you will get healthy, my friend. Question 4 from Mystical Art. Can an old jaw fracture and concussion cause panic disorder that turns into postural orthostatic tachycardia syndrome or dysautonomia? Can it be treated? Absolutely it can. I've also developed reactive hypoglycemia. Now I'm diabetic. I had all the tests done. I do have the MTHFR gene and COMT gene. Okay, gut issues and gluten intolerance. Absolutely. And you can have any kind of gene in your body and have it not affect you. You've had the MTHFR gene your entire life, but now with the physical stress, the concussion, which old jaw fracture, let me tell you, if you're getting the skull hit with a force loading strong enough to fracture the jaw, and the jaw is incredibly strong, that's going to damage the neck. And anytime you have a damage to the neck, you're altering the position and motion of the vertebrae, which alters the input to the cerebellum. And it also alters the input to the hypothalamus. So this is going to affect hormones. It's going to affect a whole cascade of that. It's going to affect pituitary function. It's going to affect a lot. So 3 things we've got to fix on you: physical, chemical, emotional. And when you go from sitting or laying down to standing up, you've got sensors in your neck, a chemoreceptor and baroreceptor, that senses carbon dioxide and blood pressure. When you go from sitting to standing, your heart rate has to increase, okay, just to keep oxygen to the brain. So if that heart doesn't sense that change in position and the heart rate doesn't increase or increases too rapidly because it's a pump. And if you have that heart doing the full contraction, it's going to pump blood and it's going to keep you alive. If there's a tachycardia where it's moving really, really fast, it's not having that complete pump or that cardiac contraction to get that blood to flow. So we've got an interruption in the nerve supply and the sensory input to the brain and to that heart. And the heart has 2 nerve supplies: top of the thoracic area and in upper cervical. That's the parasympathetic, sympathetic. Then you've got the sensors in the neck that communicate up to the brain. Then you get the hypothalamus that gets its information from the position and motion of the vertebrae. So look at the entire structure. Look at the pelvis, the lumbar, thoracic, cervical spine. Do static and stress x-rays. So you're bending, twisting, finding out what damage has been done and what can be corrected. Then look at a thermography to see if there's any dental toxicities or if there's some other type of metabolic process going on. Then, once you're correcting the stress, heal the gut, because that's where neurotransmitters are. Practice diaphragmatic breathing, because that's going to help move the organs, tissues around. It's going to help move the lymph flow around. Practice symmetrical movements to get both halves of the brain to fire. And realize, do not be labeled MTHFR, because you've had the MTHFR gene since you were born. Okay, and it has not been an issue, but now that you're under stress, it is becoming an issue. Even HLA-B27, which is like super common in a huge number of autoimmune disorders. There's billion people walking around with these 2 gene combinations with no issues whatsoever. So deal with the underlying stressors and don't worry about the genes, because the gene is different. There's the gene and then there's the gene expression. There's also a gene suppression. And that gene expression is going to be based on the stress level. So look at the stress levels, and then you're going to be able to suppress the MTHFR gene and the COMT gene. And let me know how you're doing. From Guy Lamoulins. Car accident in 2003, broke 14 ribs. This was huge. Most in my back on the left side, pneumothorax, transected aorta, lacerated spleen. I also had damage to my right knee and right arm and hand. I just survive. I don't thrive. You've got an angel on your shoulder to have that much trauma and the miracle of emergency medicine. You're alive. So let's get you healthy. Number one thing, and this is what happened to me when I was hit by a car. The emergency doctors, God bless them, they keep you alive, but they're not designed to correct long-term problems. They're just worried about keeping that heart going and the blood flowing and the brain functioning. And so now we have to fix and repair the damage and see what damage has been done. With the ribs and that trauma, we know the neck and cervical spine has been involved. There may also be subluxations, or the skull can be misaligned from head impacts. So everything has to be checked. And so we've got to look at the entire structure. I'm talking pelvis, lumbar, thoracic, static and stress x-rays of the neck. So we identify the physical stressors. Then we have to do a nervous system scan, because I know you're not sleeping well, and sleep is when the body regenerates. Then we have to look at the live blood cell, because when you're in a stress state, those blood cells lose their electronegative charge. They're supposed to be like two negative magnets repelling each other. They start to stack or overlap. And if the blood cannot hold oxygen, then your brain can't function correctly, because that little 1 kilo brain, 2 pounds, burns 90% of the body's oxygen. So we have to make sure the input to the brain, by changing the position and motion of the vertebrae, we have to restore the rest, digest, and repair, that parasympathetic, and that's located in the neck and the pelvis. And I guarantee you've had a pelvis issue and you got a neck issue that more than likely have not been addressed. Then we have to change your sleep patterns, because I know you're not sleeping well, and that's when the body regenerates. And we have to get you up to 2 to 3 healthy bowel movements a day. Your gut, 2003, that means that your body has been in a chronic state of stress with decreased blood supply to the gut. And this is where your body regenerates tissue. This is where neurotransmitters are produced. This is most of your immune system. It's brain function. It's called the gut brain. So we've got to heal that gut. And that's going to be fermented foods, healthy foods, stuff that you would recognize, and then symmetrical movements to retrain that brain. Because 2003, that's a long time that this body has had abnormal stimulus to the brain. And that's going to affect input to the cerebellum and hypothalamus. That's going to affect how your body is literally viewing the world, because every human being has 2 switches: sympathetic, parasympathetic, or fight or flight and regeneration. You, my friend, are in a chronic state of fight or flight. And you've been doing this for years. And that's why when you say, I just survive, I don't thrive, you are right now, your brain is in that survival mode. And that's all you are. And that is not good. So we deal with the physical, chemical, and emotional stress. And then we have to reprogram that emotional stress state. And that's going to be prayer, meditation, diaphragmatic breathing. And this is going to be one of the keys: physical, chemical, emotional stress. I'll help you in any way I can. I mean, this is super common with most of the patients that see me. I'm talking over half have had life-threatening injuries, and you can recover. As long as your heart's beating and you're alive, your body is designed to regenerate. Let me know how you're doing. Now, if your question wasn't answered in this video, please, because we do have to separate them into censored and uncensored, go to the drbvip.com. That's drbvip.com. And I'll respond to the rest of the questions there. So please stay healthy, my friends. And your body gives symptoms for a reason. Identify why those symptoms are there, and then your body can regenerate.